Okay, I haven't seen a huge number of people now waiting in the lobby, so I'm going to make a start unless somebody shouts to tell me to pause. So good morning, everybody. I'm Martin Jones, Chief Inspector of Probation. I'm delighted that you could join us all this morning for the launch event for our SFO report for 2024. This is my first report as Chief Inspector of Probation on this issue, and it's an issue which I think is really important. Now, for understandable reasons, serious further offences can be a major focus for the public. But I think it's really important to be clear on the facts. The Probation Service has a caseload of nearly 250,000 cases. Around about 2/3 of those people are being managed in the community, with about a third being prepared for release. Now, by its very nature, risk can never be eliminated. Unlike in our prisons, people that are being supervised in the community are in the community, of course, and their risk is very much live and present. But whilst risk cannot be eliminated, it can be understood, it can be mitigated, it can be managed. And it's worth remembering that almost everybody in our prisons must be released at some point. There's no choice around the supervision, although, of course, from time to time, people do get recalled to custody where their risk cannot be managed safely. I think we need to be clear, where a serious further offence happens, the person responsible for that offence is the perpetrator. However, it is vital for the victims and the public that the Probation Service undertakes a review to seek to identify what went wrong and if there are lessons to be learned. As Chief Inspector of Probation, I am keen to encourage learning and reflection rather than to apportion blame. Turning to our annual report, it is disappointing that we have continued to see a reduction in the number of SFO reviews that meet our required standard. More work is needed to develop and support reviewing managers alongside more transparency and the sharing of high quality data and effective practice across regions to support a collective developmental approach. I should have said this earlier. Could I have the next slide, please? For the first time this year, the annual report has also brought reflections from probation staff on their experience of the SFO review process and their experiences of the culture linked to SFO reviews. But rather than go into the findings myself, I'm going to pass over to Dave Argument, my head of programme, and his team to take you through our work on SFOs and the detail of our report. In doing so, I would point out there is a Q&A function on this call, so people should be free and positively encouraged to add questions in the chat box so that we have plenty of time to reach those at the end of this discussion. I hope it's a rich discussion that people find useful, but over to you, Dave.
Thank you, Martin, and good morning all. Thanks for joining us. I know there'll be some very busy people on the call with us this morning, so really appreciate the time and I hope you find the session useful. I'm just going to set out a bit of context and background, and then I'll hand over to our SFO team to describe some of the detail of the report that we've recently published and that's available on our website. So just a bit to set the scene. So we are an independent body as an inspectorate. We inspect the Probation Service and Youth Justice Services across England and Wales. And it's our job to scrutinise the quality of work that's delivered by the Probation Service and by Youth Justice Services. And that includes SFO reviews. We report on our findings. So
if it's on speakers, because I think it's now.
Oh, I think somebody is there. We go. We report on our findings, including SFOs, so through our annual report process, and we do that to drive system change. So we're interested in not necessarily individual decisions or individual practitioners, but how the system enables practitioners to deliver effective practice and what gets in the way of that delivery of effective practice. Can we move on to the next slide, Holly? Thank you. So that's who we are. This slide just guides you through the SFO process in a bit more detail. So I'll summarise that for people who've joined the call now. So a serious further offence review is triggered when a person on probation appears in court having been charged with a qualifying offence which was committed while they were under supervision or within 28 days of that supervision finishing. And it's HMPPS, so for people on the call who are not part of the Probation Service, that's His Majesty's Prison and Probation Service. It's HMPPS who carry out those reviews of SFOs, and they're intended to serve some fundamental purposes. So firstly, they're intended to identify learning for the probation service. As Martin was saying earlier, that's not about apportioning blame or responsibility on individual people. It's about learning, or it should be about learning, and about how the system can improve. And secondly, the report should be made available to victims and families, if that's appropriate, should they wish to access the report. So it's critically important that reviews are accessible to people in the service who've got the ability to drive change and act on learning. But also it's important that victims are provided with an accessible review that gives them an understanding of what went wrong and what the service should do to reduce the likelihood of it happening again. Across all 11 regions of the probation service in England and Wales, there are dedicated teams of SFO reviewing managers who carry out those reviews on behalf of the service. And we supplement that work by quality assuring around about 20% of SFO reviews that are conducted within regions. And I think we can move on to the next slide, Holly. Thank you. So just to give you a bit of background on our involvement in that process, this came about following our publication of a thematic inspection into SFOs, which was published in 2020. We made a number of recommendations as part of that thematic review. And as a result of that, the Secretary of State asked HMI Probation to begin quality assuring a proportion of SFO reviews conducted by HMPPS. So in 2021, in April 2021, we started that process in practical terms, and we currently deliver that through our team of 3 dedicated SFO inspectors, all of whom contributed towards the annual report, which is now published on our website. Thanks, Holly. We'll move on to the next slide. Thank you very much. So the way in which we go about our inspection activity covers 5 specific strands. So firstly, we quality assure a sample, as I was saying, of SFO reviews against standards which we publish and which are available on our website. So we rate the quality of reviews that we receive on a scale which ranges from outstanding through to inadequate. We deliver SFO benchmarking events with HMPPS reviewing managers, and they're intended to support consistency and good practice. We coordinate and we support multi-agency learning panels, or MALPs, to bring together agencies involved beyond the probation service, this is, so other agencies involved in the management of a case to improve practice more widely. We publish an annual report, which is why we're here this morning, of course. And very occasionally, we're asked by ministers to independently review SFOs ourselves. So that means, drafting the SFO review within our team. Typically, those are cases of national significance or of concern. The most recent of which was the case of Joshua Jacks, which we'll refer to later in this session, and which is detailed in the report itself. So that's a kind of practical overview of what my team does and how we approach our work on SFOs. I'm going to hand over now to Lindsay, who will guide you through some of our findings in a bit more detail. So thanks, Holly. I think we can move on to the next slide, and Lindsay, I'll hand over to you.
Thanks, Dave. Good morning, everybody. My name is Lindsay Whitman. I'm one of the SFO inspectors with HMI Probation. Thank you all for joining us this morning, where we'll talk to you about the findings of our SFO annual report. We're going to go through the headlines from the report, the feedback from the staff survey, the overall findings regarding the quality assurance of serious further offence reviews, some information around risk of serious harm assessments and independent reviews that we've undertaken, before finally moving to look at our recommendations. I have the next slide, please, Holly? Thank you. Okay, so to understand the staff perceptions of the organisational culture in relation to SFOs, this year, for the first time, we undertook a staff survey, and that was issued to all probation regions. And that included questions which were aimed at identifying staff perceptions and opinions of the available organisational support, the opportunities that exist to learn from SFO reviews, and how practice can change as a result of the SFO and the associated review process. We received representations from all of the probation regions, and we received 245 completed survey responses. Our intended target audience was operational probation practitioners, and 88% of respondents were in clearly identifiable operational roles of various grades. The remainder were in allied operational roles, such as specialist, senior managers, case administrators, or victim liaison officers. Almost half of the respondents had been in post for 5 years or more, and 10% had been in post for less than a year. Of all the respondents of the 245 responses that we received, 80% had direct experience of a serious further offence, whether that was as the probation practitioner managing the case, their respective line manager, or as a colleague. Next slide, please, Holly. Okay, so we had a number of key findings, all of which can be found in the full report, but some of them we've just highlighted here. So 55% of all the respondents did not believe that there was sufficient support for staff involved in the SFO review process. Less than a quarter, at 23%, believed that there were sufficient opportunities to learn from SFO reviews. 4 in 10 were more confident that they had changed their professional practice as a result of the findings from serious further offence reviews. But only 3 in 10 expressed satisfaction that HMPPS SFO reviews were helpful, with just a slightly higher percentage of 33% perceiving the same of the independent reviews that we undertake at HMI Probation. Next slide, please, Holly. Okay, so what we wanted to do was reflect some of the key themes that we found from the 245 survey responses that we received from all of the probation regions. And we've just given you the headline themes here, but I'll talk a little bit more about the narratives that were provided to us that enabled us to identify those key themes. So we asked for reflections on the review process as a whole, including the opportunities for learning, as well as what staff thought could be improved. So initially, what we found was that there was a pervasive perception of a blame and shame culture around serious further offences. So whilst we were clear that operational guidance clearly stipulates that the review process is not about apportioning blame, many respondents gave us detailed accounts of their experiences of feeling that blame was attributed to them as individuals, and that organisational factors such as training and workload were perceived as ignored by those undertaking reviews and senior leaders during the investigation. Next is the stress and anxiety of the SFO review process itself. This is the leading theme from respondents who felt that it undermined the principles of psychological safety. And this was also closely linked to other factors such as the organisational offer of support that's made, the tone and the approach taken by reviewers in scrutinising individual practice, and also about the recognition of the actual emotional and psychological impact of the SFO and the outcomes upon practitioners. In terms of learning from SFOs, another strong theme was the disappointment that the opportunity to learn and improve practice was not considered to be maximised during the review process. So for a lot of respondents, this related to a perceived lack of transparency stemming from the SFO review not being shared. And for others, it related to the fact that the action planning was considered process-driven and difficult to apply without having had sight of the review. Therefore, they struggled to understand the learning in context. Recognition of organisational context in SFO reviews was a strong theme, And this was because respondents felt that both HMPPS review managers and HMI probation inspectors lacked understanding about the current context in the probation service, such as understaffing, high caseloads and workloads. In addition, they also perceived that reviews were often focused on what they considered to be irrelevant and minor document omissions and errors that staff felt were not relevant to the SFO. And they felt that a balanced approach was often lacking, and that during the investigation process, there's often very little recognition of the good work that has been done in cases more widely. Some respondents were disappointed by the support afforded to them, particularly by senior managers who were not considered supportive or empathetic during the process. But where staff told us that they had received support and empathy at what can be an incredibly difficult time for practitioners, where they had received that from colleagues, managers and senior leaders, that had contributed to a more positive experience of the review process overall. Learning from SFO reviews, reflecting with colleagues and improving professional practice were also highlighted as positive elements by several respondents. Next slide, please, Holly. So in the full report, you'll find that in the section around the staff survey, we've highlighted many of the reflections and the narratives that were provided to us directly by people who completed the survey. So we've just given you 4 here, but the others are available in the full report. So the first one here, this just talks to the theme of a blame and shame culture. The second reflects how the tone and the approach taken can influence the experience, and it can either enable staff to engage and learn, or it can actually result in disengagement and for practitioners to view the process as punitive and unbalanced. The third relates to the perceived lack of transparency and a lack of confidence about wider organisational learning. And finally, the last quote is a reflection of how the approach can create a psychologically safe space for practitioners in the process. Thank you. Next slide, and I'm going to hand over now. Thank you very much.
Lovely, thanks, Lindsay. Hi everyone, my name's Hannah Williams and I'm also one of the SFO inspectors. So I have a few slides on the quality assurance work that we completed between April 2023 and April 2024. So during this period, our SFO inspectors quality assured 87 SFO reviews, rating 46% as good and 52% as requires improvement, with 1% rated as outstanding and 1% as inadequate. The number of reviews meeting the required standard has decreased from the previous year. So in comparison to last year's data, we saw a reduction in the proportion of reviews rated as good from 49 to 46%. And an increase in the proportion of reviews rated as requires improvement, and that rose from 45 to 52%. We also saw a reduction in the numbers, albeit small, rated outstanding from 3 to 1% and inadequate from 2 to 1%. We are also seeing variation regionally in the composite ratings given to SFO reviews, with some probation regions performing better than others and some regions demonstrating consistency with their ratings, and you'll find more detail on that in the annual report itself. Thanks, Holly. If we could move to the next slide, please. So there's a few other key factors identified through our quality assurance work, and this included the timeliness of SFO reviews. So of the 87 reviews we quality assured this year, we found that 76% of those were not submitted within the expected time frames that are set out by the HMPPS policy framework, with probation regions having requested extensions to the agreed submission deadline, and those extensions then having been agreed by the HMPPS Central SFO team. We continue to hear from probation regions that the SFO review format itself is not conducive to writing high quality documents. We acknowledge it can be done, and this is reflected in the ratings of good and outstanding this year, which combined show that 47% of SFO reviews did meet the required standard on this format. But it is apparent, as Dave mentioned, that this format is complex because it needs to meet 2 very different audiences. It needs to be an internal management report used by the probation service to identify where practice has or has not met expected standards, and should be used to support probation regions to take forward any learning. But it also needs to be a report that can be shared with victims or their family members, and therefore also needs to be accessible, sensitive and transparent. We're also aware that there is difficulty in providing the level of oversight and quality countersigning and assurance needed within probation regions. And there are some probation regions producing a large number of reports, and it's apparent that some SFO reviews are being signed off regionally as being sufficient and ready for quality assurance that in fact do not meet the required standard. Through our engagement with regional SFO teams, we have heard from teams who feel their resourcing and workload demands are a concern, and this does impact on how well they can respond to the SFO review procedures and how they can meet expected standards. Thanks, Holly. If you could just move to the next slide. Okay, this last slide from me then gives a brief overview of the work that we do with regional SFO teams within probation. And we're really keen to develop and build our working relationships with regions and work to support them to drive forward quality work. So our SFO inspectors work with probation regions to deliver benchmarking sessions, and this is where we will individually read an SFO review or parts of an SFO review and come together to discuss it against the SFO standards to determine elements that are written well, areas for development, and how the ratings can be assigned. Collectively, we also work with the HMPPS Central SFO team. We work with regional SFO leads to deliver Band 6 benchmarking events. And these sessions consider the SFO review at the point it's submitted to the regional lead for countersigning. So this has a slightly different lens to it, this session, and this focuses a conversation on the role of the countersigner and the lens applied to the SFO review at the point it's allocated to them prior to submission for quality assurance. We also hold individual discussions with reviewing managers and SFO leads regarding the feedback that they receive on individual SFO reviews and how to apply it and take it forward to that review, and then also how to apply and take it forward to future work as well. And we always welcome this engagement, and we'll continue to develop this further as we go through to the next reporting year. Thanks, and I'm going to hand over to Lizzie now.
Morning everybody, I'm Lizzie Wright and I'm also an SFO inspector in this team. So what I'm going to talk about now is risk of serious harm assessments, and this year in the annual report we decided to focus on this as it was becoming apparent that there was a key theme emerging with regards to risk of serious harm assessments in SFO reviews. So to start off with then, of the reviews that we looked at that Hannah referred to in the past year that are referenced in the report, 71% of the serious further offence reviews that we quality assured in that year had inaccuracies with the risk assessment. And what we found is there's a number of factors that can affect the accuracy of the assessment. So the first one is that the overall level of risk of serious harm in some cases was inaccurate from the outset. So for example, the risk of serious harm was deemed to be inaccurate perhaps at the point where the PSR was committed, the pre-sentence report was completed, or when the person was released from custody and that initial assessment was done, the review found that the risk of serious harm was inaccurate. So that could mean, for example, that the risk was assessed to be medium when the review found that in fact that should have been high. And that of course then has implications for the management of the case and how the case is overseen by the probation service going forward. So for those of you who are in the probation service will be aware that when a case is managed at high risk of serious harm, they will be offered appointments more regularly, have more robust management oversight, and then of course can be referred into multi-agency arenas such as MAPA, and also can benefit from pathways such as the personality disorder pathway, just to name a few examples. So another factor that we found was that one or more groups were inaccurately assessed. So it may be that the overall level was accurate. However, within that risk assessment, there are several groups that are assessed as to what level of risk of serious harm the person poses towards them. So for example, in a case of domestic abuse, it may be that the person on probation was assessed as a high risk of serious harm to known adults. However, in some cases, the risk to children was deemed to be low, and that was found to be inaccurate based on the domestic abuse risks that were posed by that person. And therefore, that has implications for the management of the case, as I've said. Another factor was that the risk of serious harm was accurate, but that it wasn't considered holistically, or all those who may be in the different risk groups were not identified in the risk assessment. So when we talk about presenting risk holistically, that can mean that not all information that was available was considered, or that, for example, non-convicted behaviour or any ancillary orders were not included in the risk assessment. And that was a key finding in the McSweeney review, which I'll go on to talk about shortly. And when we're saying that all those who may be at risk in the different groups weren't identified, for example, that could be somebody convicted of domestic abuse, whereby the current partner may be identified, but previous partners or family members who were previously at risk are not named in the risk assessment. And again, this all then impacts on the management of the case going forward. So there were also examples where the risk of serious harm was not adequately reassessed, and that was despite new or emerging risk factors being apparent. So, for example, there may have been intelligence received from the police to suggest there was further offending, or information that the person themselves had told the practitioner in supervision that would have warranted a reassessment of risk, and that didn't occur in quite a number of cases. And finally, there were cases in serious further offence reviews where the review manager agreed with the overall risk assessment, but the inspector undertaking the quality assurance assessed it was inaccurate. And therefore, that has implications for the quality of the serious further offence review, in that it doesn't then perhaps capture all the findings and impact that as to how the case was managed, and therefore can impact what's shared with the victim or their family. If I can have the next slide, please, Holly. Thank you. Okay, so in all these findings then, we then went on to consider why the risk was underestimated or indeed assessed inaccurately. And there are a number of factors that we found here that had an impact. So in some cases, inexperienced officers were completing assessments, and therefore that impacted on the quality. They perhaps hadn't had the right training or the relevant support in order to achieve quality assessments. And the lack of training or insufficient training available was also apparent in SFO reviews. As I've already alluded to, information was not always being sought from available sources. For example, domestic abuse or child safeguarding inquiries were not always being completed. And assessments were not based on all available information, which resulted in pertinent information not always being explored or used effectively to inform the risk assessment. So again, it may be that the person probation has reported some particular information, or something has been told to the practitioner by a social worker, for example, and that's not included in the risk assessment. And a key finding, and one that we find in a lot of SFO reviews and indeed across our core inspection programme work, is that information is often taken at face value and is not always followed up or verified, and this can demonstrate a lack of professional curiosity. And again, this is a theme that I'll come on to in a moment, which was apparent in all of the 3 recent independent reviews that we have published. Thanks, Holly. Okay, so further reasons why it was deemed that the risk was underestimated or assessed inaccurately. Risk assessments were not always reviewed when new information about risk had come to light, as I've already mentioned, and then that can have an impact on the quality of the risk assessment going forward. It's already been mentioned as well about excessive workloads, which can result in assessments being completed quickly, or they may be late and not meet the deadline, or be completed by another practitioner who is perhaps not as familiar with the case. And in some cases, there were no reviews of assessments, and that's apparent in the Joshua Jacks review, which again I'll come to talk about shortly. There was sometimes a narrow view of the risk of serious harm that was presented. So as an example, a practitioner may focus on the most pertinent risk factors and not consider the wider issues, and therefore the assessment is not always holistic and does not consider all risk factors. And in some reviews, it was noted that insufficient multi-agency working to inform risk assessments was apparent. Therefore, again, not taking the opportunity to gather all the relevant information and to communicate and share information effectively with other agencies, which would have been pertinent to the management of that particular case. Thanks, Holly. Okay, so as we've mentioned a few times already on this presentation, HMIP have published in the last couple of years 3 independent reviews. So the first of these that I'm going to mention is the Jordan McSweeney review, which we published in January 2023. We made 9 recommendations following that review, and all of those were accepted by H&PPS. And in the annual report this year, we've used the update that's been provided by H&PPS to demonstrate the progress that H&PPS are making with regards to those recommendations. So what I've done here is focus really on the recommendations and progress that specifically relates to the risk of serious harm, as I've already outlined. So following this independent review, the progress has included the following. So there has been a new approach to the assessment and planning of risks, needs and strengths, which is known as ARNS. And this new assessment is currently being piloted and is expected to be rolled out to all staff in 2026. H&PPS have made changes to the OASIS assessment to better capture offences committed in a custodial setting and to include civil ancillary orders. Those of you who are familiar with the McSweeney review will note that he had been made subject to a restraining order that wasn't considered in any of the subsequent risk assessments and which was a significant indicator of his risk. An information sharing form has been devised for prison offender managers to complete, so that's in order to promote and improve the information sharing between prisons and probation, which again was highlighted as a key finding in this case. The Public Protection Group in H&PPS have updated the risk of harm guidance to explicitly address the need to consider all behaviour and not just criminal convictions when assessing the risk of serious harm posed. And what you'll hopefully see here is there's a pattern with some of the findings from wider SFO reviews and our independent reviews, and that it is hoped that this progress will demonstrate some impact in these areas. Thanks, Holly. So the second review that we published in 2023 was that of Damien Bendel. Following that review, we made 17 recommendations, again, all of which were accepted. And again, there's been an update to the action plan that was published by H&PPS. So progress has included the following on those recommendations. It is now mandated that domestic abuse inquiries are undertaken for all cases where an electronically monitored curfew is proposed. H&PPS report that monthly recorded activity in relation to child safeguarding inquiries has more than doubled between April 22 and March 23, and recent data indicates further continuous improvement. Those of you who are familiar with the Bendel review will know that there were significant issues with regards to domestic abuse and risks towards children that were not picked up on in this case. Updates to the H&PPS sections of the new Working Together to Safeguard Children statutory guidance aim to help strengthen the arrangements that probation delivery units have with local authority children's services, particularly in relation to exchanging information. And H&PPS state that a new home detention curfew digital service will not allow the practitioner to progress a case unless the community offender manager has indicated that they have obtained informed consent. So again, all of these specifically linked to managing the risk of serious harm. Thank you. Okay, so finally, I'll come on to talk about the independent review of Joshua Jacks, which has already been mentioned and which we published at the beginning of this year. And there were several key findings, and it's important to note that many of these mirror a number of the findings from SFO reviews and from our previous independent reviews, and indeed from the findings from a number of our core inspections that we've completed over the recent months. So just to quickly run through these, and more detail of these can of course be found in the full report. So again, a key finding was risk assessment, and that this didn't cover all areas of risk. So whilst the overall risk level in this case was deemed to be sufficient, there were significant parts of risk that were posed by Mr. Jacks that were not highlighted and therefore managed effectively as part of the risk management plan. The management of the case demonstrated inconsistent enforcement practice, and it wasn't seen in the whole. So whereby there may have been failures to attend or breaches of curfew, for example, at the hostel, at the premises, these weren't seen in the round and therefore sufficient action wasn't taken. There was, again, as I've already mentioned, a lack of professional curiosity and an evidence of optimism bias in this case. So whilst he was seen to be complying and working well with his officer, there was a lack of specific offence focused work undertaken, and when he provided new information, this wasn't always followed up and was indeed linked to his risk. Again, which is a common theme throughout our findings, is resourcing and workload concerns, which again we've noted in a number of our recent reports. And there was insufficient management oversight of this case, in that advice was not always sought, and indeed the required level of oversight was not applied. Although the case was managed under the MAP arrangements, which was deemed to be a positive element to the case, there were missed opportunities within this oversight, specifically relating to managing his mental health and substance misuse and utilising the resources around the MAPA table to manage those effectively. There were also deficits in the practice of the approved premises, in that, again, linking to professional curiosity, there was not sufficient monitoring of his movements and potential risks that were emerging. And as I've mentioned, mental health and substance misuse were not effectively managed either in the community team or under the remit of MAPA. Thanks, Holly. So just to draw all the information that we've heard this morning then together, when we completed the report, the annual report of SFOs last year, we made 7 recommendations to HMPPS in respect of the quality of SFO reviews. However, we found there's been insufficient progress made against these recommendations, and therefore we have reissued those recommendations but have set further 4 in this annual report, and I've listed those here. So they specifically refer to introducing training and development for those working SFO teams in a way that enables review managers to undertake the role in a meaningful way and supports a shared learning culture among SFO reviewing teams and across probation regions. So in conjunction with the SFO procedures being reviewed, focus specifically on the transparency of the process and how the review findings are shared with those staff members who were involved in the management of the case. To take action to ensure the resourcing of SFO reviewing teams can meet the requirements set out in the SFO policy, and focus specifically on addressing the backlog of reviews and ongoing completion of reviews in a timely manner. And finally, to review the effectiveness and impact of the policy framework and approach to analysing practice when serious further offences occur, and importantly, to ensure meaningful learning is identified at the right level. And the full list of recommendations can be found on the report, which there's a link to at the bottom of this slide. Thank you, and I'll hand back over to Martin, I think, who's going to see if there's any questions for us to answer. Thank you.
Excellent. Well, thank you very much indeed. I think with perfect timing, we've got about 20 minutes left for questions, and hopefully we've already got a number of questions in the chat. So I don't know whether to sort of manage this, Louise, you want to sort of maybe put the questions to me, and then I'll work out whether I should answer them or if one of the team who are much more expert in these matters can pick them up.
No problem. We'll start from the first question, which is, as a newly qualified officer, I feel there's a lack of relevant SFO training. I feel it would be beneficial to have discussions rather than just e-learning. Is this something that might be explored as a response to this annual report?
Good question, actually, and I would fully support the need for more and better training to ensure that it picks up the themes, both in the staff survey and in our report. I mean, given the amount of effort that goes into the SFO reviews, I think we owe it to people to ensure that those lessons can be embedded and understood. Certainly, as far as a whole range of work, the HMI probation are just about completing now a thematic inspection on recruitment, retention and training, and we're going to be picking up in particular how training can be most effective. Now, we all know, particularly in 2024, that online training is a reality for us, but I think you need to assess what is going to be most useful depending on what you're talking about. And I think on SFOs in particular, I think there's a need for some reflection and some discussion in relation to what works, but also how this feels. I mean, I'm very conscious, speaking to many staff when I'm out on inspection, that people feel really heavily the weight and the fear that something is going to go wrong with one of their cases, and therefore, particularly with newly qualified people, I think it's really important that we ground it in the reality, and we ground it in the reality of ultimately, of course, There's always a risk that things can go wrong, but actually what the numbers show is that SFOs are incredibly rare, at a fraction of 1%, but also that, good probation practice can, and actually I'm sure every day of the week, we prevent terrible things happening by good management by probation officers. And that's what we need to focus on, is actually focus on doing the job well rather than being defensive. But I'm going to ask Dave, maybe to sort of come in, any further observations on that question, because you're quite often out on inspection and talking to people about their experience of being on the front line.
Yeah, I think I'd echo all of that, Martin. We'd like to see better quality training, not necessarily specifically in relation to individual SFOs, but about the principles that we find as a result of the reviews that are carried out by HMPPS review managers. I guess the other thing to add just to what Martin said is, training is at the bottom of the hierarchy in terms of how the system manages its risk. So, it's not just about providing good quality training. It's about making sure that the systems are in place for management oversight that's effective, that the SPO work is well led, that systems led by PDU heads and RPDs and heads of performance and quality are effective at making sure that people are making, appropriate decisions most of the time. But to be completely clear, as Martin said, we come across, really talented practitioners out there in the field. Almost everybody in the service wants to do their absolute best and is doing their utmost to do that. So, Martin's context set in there around, SFOs being a tiny fraction of the cases that are managed by the probation service overall is absolutely right and important to hold on to. Thanks, Martin.
Thanks, Dave. Lizzie, Hannah, Lindsay, do you want to say anything? I also wondered about the fact that we obviously do ongoing work with probation regions in relation to, and I'm wondering if you want to say anything about that?
Yeah,
I think.
Sorry,
go on,
Lizzie,
Hannah.
you carry on, honestly.
I was just going to say, we've obviously one of the recommendations from the report is about training opportunities and learning. So perhaps that can be considered as a wider piece as a result of that. We do often talk to regions about how they interact with staff in the regions about SFOs and learning. So it's apparent that does occur. But of course, then it can differ between different regions. So I agree. I think that's a really important thing to consider going forward.
Perfect. Thanks, Lizzie. Hannah, did you want to come in, or are you happy with?
No, Lizzie did say what I was going to say, actually. And just to comment, I can see in the chat that Wales, Melissa from Wales has put some information about how they approach it in Wales, and I think there is opportunity for regions to share how they approach sharing of learning and make sure that they're, whilst individuals can approach it differently, some consistency around sharing of learning, it would be helpful as well, I think.
Thanks, Hannah. That's excellent. And I think that sets us up really nicely. I mean, the one thing that I would absolutely encourage HMPPS as an organisation to do is there are some places that are doing this work really, really well. What we should absolutely be seeing doing, it's part of the role of the inspector, is promoting best practice to ensure that we drive up standards across the board. And there is some really interesting work going out there that we should seek to spread throughout the service. We've got another question from Kate, which is about the confidentiality of SFO reviews, which may place limits on what we can say to individuals. Now, I had some my own thoughts on that, but what I might do is maybe go to Lizzie first in relation to any observations on this, because I know this has come up repeatedly in relation to how we think we might do that. And then if you can come back to me, I can add any further overlay, and alpha people in the team can contribute where necessary. Lizzie, over to you first.
Yeah, so absolutely, completely take on board that is an issue with regards to how you share a review internally, where it could name and involve quite a number of other practitioners, and there needs to be some sensitivity around that. Of course, that could be, again, one of the recommendations we have made is about how that information can be shared. So that's something that perhaps needs considering. And again, part of the format of the review process is that needs to be factored in, because that was a message we were hearing quite a lot on the staff survey with regards to people feeding back that they felt like there wasn't enough transparency with regards to the findings of a review. So I guess there needs to be somehow a way devised of sharing that, so it it can assist everybody in the process, whilst not compromising individual confidentiality, really. So not really an answer to how you do it, but it's certainly saying it needs to be addressed. I don't know if Lindsay's going to come in with something more robust.
Yeah, Lindsay, if you've got the magic answer for it, you've got the magic wand.
I'm afraid I don't have the magic answer, but probably helpful just to provide a bit of a wider response to Kate's question as well, because I think it is a really good point as to whether or not, I think what Kate's also asking there is, are staff or practitioners aware about the confidential and the fact that it's not necessarily a transparent process? And I think just to add to that, so I looked at all 245 responses to the staff survey and all of the detail, and it's a really mixed picture in terms of whether or not staff understand that there actually even is a report and an action plan that's produced at the end of it. So for some staff, part of the issue around this is transparency of the review process overall. So they're not aware necessarily at what point they'll be interviewed, that they'll even be interviewed, and what that looks like, how that process is undertaken, what's taken into account. Some practitioners are well aware that there is a report and an action plan produced, and they have asked the question to see the learning, and they're aware about those confidentiality issues. For others, they're not aware of that process, like I said, so they don't know that would be the reason why. And for others, I think one of the key themes that really stood out was the fact that practitioners talk about going through the interview process, that sometimes they are given feedback in real time about what will be learning points, but they say that either that learning never materializes in the form of any official feedback asking them to undertake particular practice improvement points, or the timeliness is so long that they haven't got to the point where there's been an actual outcome to that or a follow-up. So I think it's a wider theme there around practitioners understanding the process as a whole and actually what products are produced at the end of that. And I hope that answers the question more widely, Kate.
Perfect, Lindsay. I think that sets it out really well. So I guess my other observation would be that the recommendation that we've got here is addressed to HMPPS nationally in relation to, I'm not sure what the answer is, but it's certainly something that needs to be thought about. The other thing I wanted to share with people, before becoming Chief Inspector of Probation, I was Chief Executive of the Parole Board. And again, we have an absolute focus on where serious further offences happen following a Parole Board release decision. Now, as part of that, we give some quite careful thought to how do we notify somebody who's been a parole board member who's made a particular decision, what support we provide them around that, and the transparency at the end of that process. The bit that I absolutely recognise, and we can't shy away from this, if you have been involved in a case, you've been doing your best, whether you're a newly qualified probation officer or somebody that's been in the service for 20 years, of course it's going to go right to the heart of you, and it's going to hit you in the guts in relation to, obviously, nobody comes into work. You come into work to prevent things happening, and unfortunately, when these do happen, that's always going to hit people really hard, and there's always going to be some stress attached to that. I think what I would say is that if we think about how do we support people through that process, how do we explain it up front, what information can you give to people, hopefully we will sort of assist them through that process. The bit that I am sure about is there must be a way of providing a safe way of giving people feedback on the review, which we want them to, get involved in, in the spirit of honesty and the spirit of learning, to ensure that they can have a conversation with somebody at the end of that to provide them with some feedback in relation to what their learning would. Because of course, in sometimes what we're saying is actually you did everything right, actually, and it's really important that people understand that. And unfortunately, the world is an unpredictable place where things can sometimes go wrong. So I think there's learning to be had. And certainly, as far as HMI probation are concerned, really happy to sort of carry on talking to HMPPS about how they might deliver upon this. But I think probably I can imagine some ways in which they that. And there are other examples of public service where similar reviews take place. And obviously, we can learn from those as well. But I think it's a really good question, Kate. Thank you. I think the next question that we've got in the chat is from Zana, and she's asked the question about, we're always always hearing lessons will be learned, but from Anthony Rice through to Damien Bendel and SFOs in between, themes running through them will misjudgment of risk, assessment, lack of communication between agencies. Why are these lessons not being learned? Again, I can more than happily have a crack at that question. But Dave, I might go to you first, actually, and then ask the team whether they've got any observations on that question, and then come back to me.
Yeah, really good questions, Anna. Thank you. So I think the reality, sadly, is that the probation service currently, has too few staff with too little experience, and too many cases and too much complexity to manage. That creates really difficult conditions in which people can learn and in which the system can learn. So there's some practical realities that the probation service currently faces which get in the way of learning. But that's not to say that the way in which SFO learning is translated into action on the ground couldn't be improved. And one of the things we find, frequently through our core program inspection works when we inspect PDUs and regions, is that quite often there's a disconnect between, what SFO reviewers are finding in aggregate form, i.e. bundled together, thematically, and what we see practitioners understanding and SPOs and hence PDU understanding on the ground. So there's more work we think that the probation service can do to bridge that link between the good work that comes out of learning from SFO reviews in many cases into actual practice on the ground. But there's some practical realities at the moment that have made it extremely difficult for the probation service to move forward. Within the last week, we've announced a national inspection of the way in which HMPPS is led. It's the way in which it's staffed, across the country, and the way in which central functions support regions. We expect to cover some of this one as lines of inquiry during that inspection. So, in particular, what is it that's getting in the way of the probation service learning lessons from what's gone wrong previously? So yeah, I think that would be my response to that question, which is a really good one. Thanks, Martin.
Great, fantastic. Lizzie, Hannah, Lindsay, anything to add on to what Dave said?
No, I think Dave covered it in terms of like when he said what we're seeing on the wider inspections. Absolutely, there is some wider systemic issues that are perhaps influencing the way that recommendations are taken forward. So no, nothing to add. Thank you.
Thank you very much, Lizzie. I mean, I guess the other observation I would just make on top of that, and I've been around the justice system for 30 years, and I've seen lots of examples where things have gone horribly wrong and we've made recommendations as a system about those. And the one thing that consistently comes up is problems with information sharing between agencies. And I do wonder in 2024 why we haven't got this cracked. And I think it's something that certainly is going to be my focus as Chief Inspector, on the basis of, my question is, why not? Actually, we owe it to the public, we owe it to victims to ensure that we share in a timely way information between partners that better enable us to understand and manage risk. And some of that is about information protocols. Some of it, I think, is about will. And I think will is something that we need to tackle with senior leaders. And in particular, sometimes I think there are particular areas around getting information from the police, for example. Again, my question, my challenge is, surely we want to ensure that the probation service has the information to ensure that they can manage that risk properly in the best way. And that's for all sorts of good outcomes for the public, and also good outcomes for the person on probation as well, because it better enables us to then make the interventions that we need. So I think it's a great question. The next question that I've got from Anne Burrell: is there any evidence regarding connections between the speed at which pre-sentence reports are now completed and links to subsequent SFOs? It's now routine for PSRs to be oral or other fast delivery reports, whereas in the past most were standard delivery reports, which I know take longer, which provided time for inquiries and a much fuller and nuanced initial assessment. And I think that's a brilliant question, and it's one of the questions that I've been asking myself in relation to, if you look at the timeline for the last 10 to 15 years, the number of community orders has fallen really significantly. I think that's for a whole variety of reasons. It's not for a single reason, but I also think it's linked across to the reduction in the number of standard delivery reports. And for many of the people that appear in our courts, we know that it's quite possible to send that person to prison, for a 6-month period of time. You've committed an offence, it's probably serious enough. But the question of what lies at the heart of the offending, what interventions are likely to work in relation to reducing their risk in the future, quite often a well-judged probation report is going to influence a sentence, a decision in relation to what the most appropriate sentence is. My question and my challenge, and I think it has to be looked at as part of the sentencing review, is ultimately the rush to get on with things, if it leads to ineffective sentencing, is for the good of nobody. And I'm absolutely sure from the work that I've seen in a whole variety of reports published by the Inspectorate, that if you rush those reports, you do miss things in relation to the risk. And if ultimately you start off from a position of not understanding fully the risk that person represents, of course, that makes it much more difficult for everybody at every future stage of the process. And of course, and as the team have highlighted, you need to keep re-reviewing things and things through that. But of course, the better your start, the easier it is. And it's something that I think the system needs to look at really anxiously. Dave, do you want to add anything to that?
I don't think I do, Martin. I think that was really comprehensive. I don't think I've got anything to add to that. Yeah, yes, nothing to add.
Okay, as long as I'm keeping Dave happy, I know I'm doing something broadly right. We've got about 3 or 4 minutes left. The next question was from Damon, who's asked a question about ARMS, and that is the new system. I don't know whether hopefully Helen Cox, who's one of our HMIs, has also chipped in that she was at a recent roundtable involving the digital team relating to ARMS. I know that there is discussion going on as part of it, but Dave, Hannah, Lindsay, anything you want to add about ARMS as a way forward in the future?
Just to add that Robin Moore, who's our head of research, has been consulted on as part of the development of ARMS. So yes, the answer is yes, Damon. We most certainly have been linked into some of the development activity that's been taking place. Yeah.
Perfect. Thank you, Dave. I've now lost my place on the questions by scrolling up too far. Raymond has asked a question. Is a review of the SFO approach being considered, perhaps more along the lines of appreciative inquiry methodology? I'm going to go to Lizzie, Hannah and Lindsay initially for anything in relation to that, because obviously I know that you've been speaking about what ways they could improve the SFO approach.
Sorry, yes. So, hi, Ray. We haven't got a position from HMPPS yet in terms of how they're going to be taking forward these recommendations forward. But we're keen to hear what a review of the SFO approach, what a review of the SFO standards and procedures will look like, and we'd happily be involved in any conversations in terms of how that could change and what sort of approach to the methodology could be taken forward. But at the minute, no, we haven't got any sort of formal understanding of what it's going to look like.
Perfect. Thank you, Hannah. Given the questions, I'm going to fast forward through. We've got a couple more questions, one of which I think I can answer myself very quickly. Susanna has asked, will ARMS be rolled out for all sectors such as prisons as well as probation? I think I can be pretty confident in saying that the intention is that it will read across to prisons and probation, unless Dave or Lizzie or somebody shakes their head. Okay, that's fine. Hannah has asked a really good question about the template and the guidance expectations that reviewers have to adhere to, and the length and expectations of the template doesn't work for anyone. Lizzie, do you want to sort of maybe come in as part of that, and then obviously anybody else on the team?
Yeah, so I think, hi Hannah, I think what Hannah's reflected there is probably quite a lot of the information sharing that we've had from regions about the process and the fact that there is, and as our report highlights, there are some challenges with meeting all of the expectations that the policy sets out. So as Dave mentioned right at the beginning, the purpose of the review being for very different audiences in that it needs to highlight internal findings and learning, but equally be transparent and effective for victims and families that need to see that. And we have had feedback from regions regarding our format of independent reviews being very different. Of course, our independent reviews don't follow the HMPPS policy because we set out our own independent style of doing a review, which is why, of course, they're different. And there has been comments before about whether that's more beneficial or not. And again, that should hopefully form part of the review that our Hannah's just alluded to, in the sense of we don't know yet what that's going to look like. But of course, the views on that are really welcomed as to what is the most beneficial approach to meet the needs of all the relevant people that need to learn from and see that review.
Perfect. Thank you very much, Lizzie. I'm conscious that it's now 11:30, so our time is up. I'm extremely grateful to everybody for coming along and listening to us this afternoon and engaging in the conversation. It's extremely helpful for us to have that ongoing discussion. And certainly looking more widely at this, I think this report has been a really helpful one for us, and also I hope for HMPPS in relation to reorientating the way we get the best possible value out of SFO reviews. And it's certainly something that I've been reflecting on in recent weeks following the quality of that report. I'm conscious that there are a few questions that have not been answered because we haven't had time. We will try to capture those and we'll try to come back to people if we possibly can to ensure that we answer those questions as well. And this recording will be published in due course for people that are interested to see it who couldn't make it today. So thank you very much, everybody. And I look forward to seeing you at a future event. Thank you very much. And thanks to the team.
Thank you. Bye.
Thanks. Bye.
Thank you.